Hello everyone, how are you doing? Are you ready for exit, COC or comprehensive exam? Well, don't be frustrated. Be resilient. I bring the video regarding the exit, COC or comprehensive exam, which you can easily understand and prepare you for exit, COC or comprehensive exam. So don't forget to like, share and comment for difficulties question, and if you have any suggestion regarding with my video you can inbox me. This is the obstetric question number 1. What is the recommended amount of weight gain during pregnancy for a woman with a normal pregnancy body mass index 18.5 to 24.9 kilogram per meter square? A, 11.5 to 16 kg, B, 9 to 10 kg, C, 5 to 11 kg, D, 16 to 20 kg. Think over it for 5 seconds. The correct answer is A. Why? According to Institute of Medicine guideline, women with normal body mass index gain 25 to 35 pounds, what we call it 11.5 to 16 kg during pregnancy. This weight gain is ensure the proper fetal development while minimizing risks of complications such as gestational diabetes and hypertension. Question number 2. A daily supplementation of iron 30 to 60 mg of elemental iron and 0.5 mg folic acid is recommended by World Health Organization to prevent all of the following, except A, low body mass index, B, anemia 37 weeks of gestation, C, puerperal sepsis, D, low birth weight. Take the moment for 5 seconds. The correct answer is A, because anemia, the iron and folic acid recommended during pregnancy to prevent anemia. What we call it, iron deficiency is a major cause of anemia and also puerperal sepsis and low birth weight. However, supplementation doesn't directly prevent low body mass index. So this is not directly influenced, so the correct answer is A. Question number 2. What is the fetal lie? Presentation in a position if the head is down, flexed, and fetal back is near to the maternal pelvis. Additionally, on straight vaginal examination, a diamond fontanelle is noted near. There is child spine and triangle fontanelle is leading edge. The sagittal suture is not parallel with the floor. So, what is the lie and position of the fetus? A, longitudinal lie in left occipital anterior. B, longitudinal lie in right occipital anterior. C, transverse lie in left occipital anterior. D, transverse lie in right occipital anterior. Think over it for 5 seconds. The correct answer is A. Longitudinal line and left occipital anterior. Why? There is the back near the maternal pelvis, occipital towards the maternal left anterior side. A triangular fontanel, what we call it, occiput. What we call it, the occiput. The occiput is a leading part, and diamond fontanels. The diamond fontanel, what we call it, is the interior fontanels left near the right ischial spine. This confirms that left occipital anterior. Because sagittal structure not parallel to the floor, so there is a slight rotation. So the correct answer is A. Question number 4. Which vaccine is not contraindicated in the pregnancy? A. MAPS, B. measles, C. rubella, D. influenza. Think of it for 5 seconds. The correct answer is D. Why? These all MAPS, measles, rubella are active vaccine, so it is the contraindicated in the pregnancy. The influenza is the died or inactive vaccine, so it is not contraindicated in the pregnancy. So the correct answer is D. Question number 5. A 38 years old gravida 7 para 6 mother came from antenatal care follow-up at 32 weeks of gestation from non-hookworm endemic area. Her vital signs are within the normal range. Pink is conjunctiva and the mucosal membrane are pink, and hemoglobin is 30 mg per day. So, what is the prophylactic drug should be provided to this mother? A. Mebendazole, B. ampicillin, C. magnesium sulfate, D. amoxicillin. Think over it for 5 seconds. So the correct answer is mebendazole. Why? This mother came from hook endemic area, so as a preventive, the mebendazole 500 mg PO stat is recommended for this pregnant woman. Question number 6. During the routine prenatal visit in the office, you notice that the fundal height of 23 years old premigravida woman who is after 2 weeks of gestational age with a normal blood pressure is measuring only 28 centimeters. She has been complained with her prenatal care since 7 weeks gestation and reported a normal appetite. She denies any leakage of fluid per vagina. What is the next best course of this action? A. Perform Leopard maneuver and inform the patient that fetus is in presentation. B. Perform amniocentesis to determine the status of fetal lung maturation. C. Repeat prenatal labs including 1-hour glucose tolerance tests. D. Perform ultrasound to determine estimated fetal weight and amniotic fluid index. Think over it for 5 seconds. Okay, the correct answer is D. Why? The fundal discrepancy of greater than 2 cm suggests there is intrauterine growth restriction or oligohydramnios. So, the ultrasound is the best measurement for this scenario. Question number 7. A woman presents to your office for prenatal care. She has had 2 abortions, 1 ectopic pregnancy, and fetal demise at 37 weeks of gestation, and 3 alive births. Her son, who is now 13 years old, was delivered at 34 weeks. gestation by spontaneous vaginal delivery, and her daughter, who is now 10 years old, was delivered at 38 weeks of gestation by cesarean section secondary to fetal distress during labor. Her youngest daughter, who is now 5 years old, was delivered at 33 weeks of gestation. So, what are her gravidas and paras by simple notation, by TPL and notation respectively? By simple notation and by TPL notation respectively. TPL is T, term, P is preterm, A, alive baby, A is any abortion, ectopic, and L is alive. So, A, gravida 8, para 4, B, gravida 8, para 3, gravida 7, para 3, D, gravida 7, para 4. Think over it for 5 seconds. The correct answer is A. Why? Women present to your office with prenatal care is 1 pregnancy. There is 2 abortion, 3. Y ectopic, 4. And there is a fetal demise is 1 for 5. And also she has what? Has 34, 38, and 33 is 3 number 3 are live children. What we call plus 5 plus 3, 8 gravida. And para is which is delivery after what? 28 weeks of gestation in our context. So 1, 2, 3, 4 paras. Any abortion ectopic pregnancy not counted as a para. So the correct answer is gravida 8 para 4 by TPL notation. Gravida 8 para, there is 2 terms, 2 preterm, 3 alive children, and 3 abortion, and 3 alive children. Okay, question number 8. A 27 years old gravida to para 1 mother came to health center for routine and service on 05/07/2030 Ethiopia calendar. During the course of assessment, the midwife asked her last normal menstrual period. Her menstrual bleeding was regular for 1 year, and the last normal menstrual period started on 21/01/2030, ended on 26/01/2013 Ethiopia calendar. So, what is gestational age of this pregnancy? A. 23 weeks plus 3 days, B. 2 weeks plus 4 days, C. 23 weeks plus 3 days, D. 24 weeks plus 3 days. Think over it for 7 seconds. Okay, the correct answer is A. Why? The gestational age calculated by visiting date minus last period. The first day of last normal, don't forget, by the way, most of students exam. The visiting date is this one, 0.07/2030 minus the first date of last normal period is 21/01/2030. Not this one. When you subtract this one, 05/07/2030 minus 21/01/2030, you can get 26 plus 3 days. You can calculate it. Question number 9. A 34 years old woman attends MSH clinic at 20 weeks of gestation. This is the woman for the pregnancy and the second child. She had SFD 3 years ago, and this followed by 2 spontaneous abortions. But the cause for abortion was unknown. The midwife performed an anomaly scan, and it shows the normal fetal growth and amniotic fluid volume. but the lab investigation shows the blood group is O negative, O minus, and antibody is present. So, from the following choice, which one is not used to manage the pregnancy? A. Monitor maternal antibody level 2 a week. 2. Chordosynthesis. C. Fetal ultrasound should be performed to assess growth retardation, sign of hydrops, and liquid volume. D. Administer anti-immunoglobulin at 28 weeks of gestation. Think over it for 5 seconds. The correct answer is D. Why? The antibody should not be given if antibodies are already present. This pregnant woman is sensitized or represent, so this is indicate the maternal sensitization. Still, the pregnancy must be monitored for fetal animal. For example, this is monitoring fetal antibody level 2 weekly. Chordosynthesis and fetal ultrasound is the best management for sensitized pregnancy, but administering anti-immunoglobulin for sensitized pregnancy is not important, not used. The last question, a failed vacuum is considered in all except A. Failure to descend with each pull. B. More than 2 poop-off. C. Maternal refusal for application. D. Failure to deliver after half an hour of application. Think over it for 5 seconds. The correct answer is C. Maternal refusal for application, because the maternal refusal is contraindication for vacuum delivery, not a criteria for failed vacuum. So the other option indicate failure of the procedure. For today, it is enough. Thank you very much. Until the next time. If you like this video, don't forget to subscribe it. Thank you very much. Have a nice time.